It's Daniel Kubismeyer. I'm the Executive Director of Riverwood Mental Health Services, behavioral health provider, and also the Director of the Housing First Rhode Island program for the chronically homeless. And I want to talk about three things that are actually good about the system. One is that permanent supported housing for the chronically homeless can result in substantial Medicaid savings. Eric Hirsch, a researcher from Providence College, looked at 67 of the highest users of Medicaid services amongst the chronically homeless and determined that $60,000 a year was spent per person for the 67 folks. And if you take a look at studies done nationally, permanent supported housing will reduce these costs, well, whatever the access to services results from it, will reduce the costs from 25 to 50%. For those 67 people alone, that would result in between $1 and $2 million in Medicaid savings. And with the Affordable Health Care Act, the entire chronic homeless population technically is not eligible for Medicaid services because of the income requirements. So permanent supported housing is an inexpensive way to really affect some true Medicaid savings. Secondly, I want to mention that the U.S. Surgeon General years ago noted that persons with serious and persistent mental illness had a life expectancy of 25 years less than those not so afflicted. One of the main reasons was not being able to access primary care in a timely manner. Dramatic strides have been made to deal with that here in the state. Health homes have been instituted in behavioral health care programs and serve to manage that interface between the behavioral health and primary health care organization, primary health care provider. We need to ensure that this vital program continues. Not just because it saves lives, because it catches problems early when they are treatable in the most effective and cost-effective manner. And lastly, as you contemplate the various types of service delivery, I just want to say there's value in not just the services being community-based, but the organizations themselves are community-based and accountable to community-based boards of directors. Riverwood is a part of a partnership with three other organizations called Horizon Healthcare, which are all community-based organizations who focus on not just the psychiatric and substance abuse needs, but housing, medical needs, employment, social. It's been said before that it's not just the medical needs that drive Medicaid, but that the other supportive services around it can truly drive down Medicaid services.